Okay. So I'm Dr. Mady, and I'm teaching 2 sections of 320, and then with us is Dr. Jabber. Do you want to say something, Dr. Jabber?
Hi everybody, my name is Rana Jabber. I'm teaching 2 sections of 322, 320. Welcome everybody.
Awesome. And so what Dr. Jabber and I do is we try to have this at the beginning of every session that we have or every course because it allows you guys to ask us questions. It allows us to talk to you guys about assignments, just kind of see how things are going. I know that we're getting into week 2, almost halfway through week 2, so it's going by very fast. And so Dr. Jabber and myself, we're just going to really go quickly over kind of what's expected and then look at some assignments and let you guys ask some questions. Does that sound like a good agenda?
Sure.
Yes. Yes.
Okay.
Okay.
All right. So Dr. Jabber, do you mind if I start?
Yeah, of course.
Okay.
Just go ahead. Thank you.
So what you'll see is your main Canvas page here. And I know by this time you guys are Canvas pros. So you probably don't need any help with this, but just make sure that you look through the syllabus. This is where you can find our office hours, our email, our phone number. I know personally for me, you can text me. Make sure that when you text me that I know who you are. Feel free to text me. I usually respond back more quickly, is that a word? More quickly than I would be if you emailed me. So please feel free to text me. I usually will text you back. If for some reason I don't text you back within a few minutes, that just means I'm unavailable. But as soon as I see the text, I definitely will text you back. How about you, Dr. Reyna or Dr. Jabber?
Yeah, me the same. I prefer email. I'm always on my emails, like I will respond very quick because I'm always holding my cell phone. So if you need any help, and text is okay with me also. So both is okay. So
Awesome.
just I need a feedback always. If you need any help, just don't hesitate to call us or whatever, like a phone or email. Both is us.
And I will just emphasize what Dr. Jabber just said. You know, we are here for your success, so don't feel like you can't contact us at any time. No matter what's going on, if you have a question about absolutely anything, please feel free to reach out to us. That's what we're here for. You know, being online, we don't see you face to face, so you know, let us help you. Let us know, you know, what's going on, and we definitely will help you in absolutely any way we can. So I hope you guys are okay and comfortable with contacting us via email or cell phone. All right, so any questions about contacting us?
No.
Okay.
No, thank you.
Okay, so as I move through the syllabus, hopefully it doesn't make you nauseous. If you get car sick, I know it can kind of do that, but I'm not sure going through the syllabus, you know, you've got your program outcomes, your course outcomes, you've got your different policies that we can refer to. Down here, you've got your assignments, and then further down, you've got just a course outline, which is really good to keep track of and just kind of mark the weeks off is what I do. And so we can mark 1 week off or week 1 off really quick now. So then if we look at week 2, which we're in now, we will have a assignment due, and that would be your examination of an organizational structure. And so I guess what we'll do is we'll go into your modules tab, and we will go down to module 2. And here is where you can see your checklist, your objectives, your reading assignment, your lecture, your discussion questions, and then your module 2 assignment. So we'll click into that. Now this will give us an idea of what is expected of us within this assignment. So This assignment is worth 200 points or 20% of your grade, so it's a big deal, you know. Here's where we want you to examine a healthcare organization structure and then the role of nursing within that organization. Now, your lecture 2 offers a tremendous amount of information regarding help with materials for this assignment. So I'm hoping that you're looking at those. The other thing that will help you is I know we have a discussion question this week that concerns organizational structure. So I would hope that you guys would kill two birds with one stone, so to speak, by utilizing the discussion to kind of start writing your paper. And so I'm not sure if you guys have thought about that, but you know, if you are talking about your hospital's organizational structure or your clinic or the military or any type of organizational structure that you want to write about, start talking about it in the discussion, because then all that hard work and all that research you can utilize for your assignment. Usually we have to go out and find scholarly resources, and so now you've done a lot of the work by going out at the beginning of the week and finding those resources. So as we move down, so the instructions, I think by now you guys should all have your healthcare organization hopefully discussed within the discussion board or kind of in your mind if you've not replied yet to the discussion board. And then this is an APA written paper, which you guys are all aware of APA at this stage of the game. So if you look at 2, 3, 4, 5, 6, 7, 8, 9, and 10, those should be your level headings. That way you will not forget a certain specific criteria of the paper. So let's say your level 1 heading first is introduction. Then you're going to answer number 2 instruction all within that section. So now you're going to let the reader know about, you're going to identify the type of the organization. With this one here, it says do not provide identifying information such as name of facility or address. If you want to give it a bogus name, we're okay with that. I've actually, you know, everything that we grade and everything we look at is FERPA, and you know, we're not going to go out to that facility and say, oh my goodness, this student thinks this, and you know, that's not what it's about. So I know some students put the name on there, and we're okay with that. You know, we're not going to go around and distribute these papers, but you can go ahead and just give it, you know, whatever name you want. If you're referring to the Utah hospital or something, just give it a different name. We're okay with that. And then also make sure you explain why you've chosen this organization. So under each criteria, if there's more than one item that you have to discuss, make sure that you discuss each of those items. Because if you know, if Dr. Jabber and I don't see where you've explained why you've chosen this organization, you'll get points taken off for that. And then just go
I have
through.
a question.
Yes. And who's talking?
Kezia.
Hi.
It's about if you pick like an organization like the hospital.
Yeah.
Could you specify whether it's an acute or long-term care?
Yep. You can do that. Yep. More detail, the better. So that would be great, because I think those two are completely different organizations, aren't they?
Yeah.
Yeah. And so make sure that you do that. So
I
great
have a question.
Yeah. And who's talking?
This is Jane.
Hi, Jane.
So when it says to change your name of your organization or whatever, what about the mission statement from that organization? If I want to include that, how do I cite that?
Well, you know, you have to be able to cite your, and see, that's where it comes in. That's where it's crazy, Jane, is, you know, if you need to put in the name, we are completely okay with that. This is not going to be published. This is not going to be out in the public. So, you know, you're going to have to because somewhere along the line, you're not going to be able to catch all the items that you need to change, and that would cause a lot of work for you guys, and we don't want to do that. So, you
So
know,
just keep the name.
yeah. And how
It's
do you
okay.
feel about that, Dr. Jabber?
Yeah, it's okay because it's a
Yeah.
public information. Everybody knows. You get all the information from
Yeah.
from the net, so
Right.
it's like confidential. So you can
Yeah.
use the net. That's okay.
Yeah. And
Okay,
you know,
thank you.
this paper is not about opinion. It's not about the negatives and the positives. It's very structured, so to speak. And so all you're doing is you're just enlightening us to an organization. So, you know, feel free to use the name. Yeah.
Yeah. And it's very important to read the rubrics before you start. So you can, it will help. It's very helpful to read your rubrics and work according to your rubrics and the instructions above. So you will get a good grade. See everything in the rubrics. When you go look outstanding, highest level of performance, what do you mean by introduction, types, organization, identify, hospital, long-term care? So everything is written here. So if you just take a look at the rubrics and try to just work with all the instructions from the rubrics, will be okay.
Yeah. Yeah.
Everything is here for you.
Yeah. And I'm
Yeah.
hoping that everybody knows where to find their grading rubric, which is attached to their assignment. And so you can see where there's 20 points for introduction. So if by chance you forget your introduction, that's 20 points right off the top, and you don't want that. Next, moving down would be your mission, vision, and philosophy, and maybe they just have a mission. That's okay, you know. And then next would be your performance objectives and or strategic plan. Now, you're going to have to dive into that organization a little bit in order to find out what is their strategic plan, what is their performance objectives. So, you know, you might have to visit with your director of nursing or visit with someone and just let them know, you know, you're a student, you're representing Eagle Gate, and you're asked to write this paper about an organizational structure, and it talks about performance objectives and or strategic plan. And so, you know, most it's employee knowledge. Usually they have some type of notebook around there that talks about their strategic plan. So make sure that you provide this within your paper, and then talk about your organizational structure. Now, this is what we've been talking about this week so far in our discussions and our lecture. So anybody want to give us an example of an organizational structure that maybe you've talked about this week in discussion? Nobody?
There's the flat one.
Yep, there is flat. Yep. Decentralized. So you guys
It's a
all know where
vertical,
to. I'm sorry?
the vertical one.
Mm-hmm.
Vertical.
There's.
Go from the top to the
Mhm.
continue. I'm
Yep.
sorry, continue.
Yeah. And so you know where to find these. There's great examples within your lecture too. So
Well, you
make sure.
posted them on our
I did.
discussion.
And thank you for that, for saying that, because sometimes students don't see that. And so I did post that just to remind students that these are the organizational structures that we want you to look at. And it's only for your own benefit, because if you start researching a specific structure right now, then just utilize that information to start writing your paper that's due Sunday. So, you know, don't reinvent the wheel. You guys are doing a fantastic job with researching and bringing about knowledge. And so go ahead and utilize what you're doing for this week's discussion and just start writing your paper. Does that make sense, everybody?
Yes.
Okay.
I have a question. Sorry, this is Jane.
Hi, Jane.
So in the lecture, you have a shared structure, but you didn't list it in the discussion. Can I still use that shared structure?
Well, if your structure actually has a shared structure, then I can't tell you no, you can't use it. You know, if that's
Okay.
truly what is happening, then that's what is going on. So, yeah.
All right, thank you.
If that makes sense. I mean, this is all, we give you guidelines, but this is all your guys's creativity and your research and your work. And so we'll just give you guidelines to help you with that. Okay. Next would be your flow of communication. So what is their flow of communication? Not about, well, their communication is good. What we're talking about is what is their chain of command? Who's at the top, who's underneath that person, who's underneath that person, different things like that. And so when you've got a problem or an employee has a problem, what is their chain of command? And then what is that person? Who does that person go to? And then who does that person go to? And so they should have a chain of command or a flow of communication. So be real specific with this one. And then an organizational chart. Now I've gotten some questions regarding, well, what is the difference between my organizational structure and my organizational chart? So if you can think of it this way, an organizational structure is designed around the functions of a business. So what the business performs. This is where the structure defines the purpose, who's accountable, and then key performance indicators. Now this chart is within that structure. Now the chart is built around people and titles. And so this is where we are asking you about, where is nursing identified in this organization? And some students will just add a picture into their paper, and I'm okay with that. Would you be okay with that, Dr. Jabber?
Yes.
Okay.
Yeah.
But just make sure you cite the picture on where you got it from. And if you need to create your own picture, go ahead and do that. Or if there's one that's like it out there, and you can utilize it, go ahead and do that. And so these are very, very two different things. Structure, what holds it together, what is the walls, and then the chart is inside those walls. And so those are all your interdisciplinary teams. And then make sure you talk about where nursing is identified within this organization. Okay. Any questions so far?
Okay, so this is Jane. Just to
Okay.
clarify, the chart that you're talking about is what is made of the interdisciplinary team.
Yep, the people and their titles. Yep.
And then the structure is
The
I'm
flat,
confused
the
on.
decentralized.
Okay.
Yeah. That's
Okay,
your
cool.
broad spectrum. And so just think of it as your decentralized house. And now, how many rooms do you have and who's in those rooms? Nursing is over here in this area, and nursing talks to this area, and different things like that. If you can put it into different perspective. Yeah. So thank you, Jane, for that question. Any other questions? So next would be shared governance. So is the use of shared governance model identified? If it is identified, talk about the advantages and or disadvantages. But if there's no shared governance model utilized, you have to let us know that, just so we don't think, oh, well, they didn't talk about that, so we're going to take 20 points off. Most organizational structures have shared governance. So it's very rare that they don't, but if for some reason they don't, make sure you let us know that they do not utilize a shared governance model. Okay.
I have a question.
Yeah.
Is the shared governance kind of like the board of governance or something like that?
Shared governance would be like there's some structures, organizational structures, that do not allow shared governance. So the people at the top make all the rules. They don't take into account what everybody else thinks. And so shared governance, is it active within nursing? Is it active within that hospital? And so are people willing to come together and make a decision based on everybody, not just the leader at the top? Does that answer your question?
Mainly, they will share the governance in our hospitals because there is a say for the nursing, for example. There is a say for everybody in the team.
Yeah.
Yeah, they will listen to everybody. They will do like a team, and they will listen to the say of everybody, and they will make the decision based on their suggestions or. I think.
But you know, there are some organizations that do not utilize shared governance.
Yeah.
So, you know, just
Is
let
it
us know.
like is it like in a nursing home where you have like the department heads and then you have one who's in charge of many more nursing homes put together who are the board of governors? Is that
Oh, I get you. I get you. No, that would not. That would be more like your organizational chart aspect. This is what you might have to ask those, you know, the board. Where do they get their information? Does it come from nursing? Does it come from radiology? Does it come from patients? And this is all a shared governance model. And so your board of directors is more like a chart. And so you might have to ask, so with nursing, do you guys have shared governance here? Are you guys able to weigh in on the decisions that are being made within this organization?
okay?
Yeah.
Thank you.
And you can just read about, you know, shared governance in the lecture. You can read about shared governance through research when you go to the library and find articles that talk about shared governance, some of the advantages and disadvantages. So there's going to be a little bit of prep work before you just sit down and start writing your paper. And so, you know, maybe interview somebody, maybe talk to people within that organization so you can get a good view of what's going on before you start writing your paper. Next would be your pattern of nursing care. And so this talks about advantages and disadvantages. So make sure that you talk about both, that you just don't talk about the advantages. Because we're going to grade you on both advantages and disadvantages. Now, we do talk about pattern of nursing care within the lecture and then within the discussion questions itself. And so hopefully you guys have already started doing your work on here. So any questions with the pattern of nursing care?
Could you explain a little bit more about the pattern of the nursing care?
Well, let's go to this week's lecture. Sorry if I make you nauseous. So if you want to go to this week's lecture, you know, we've talked about the structure. There's a strategic plan. Here's your structures that we're talking about utilizing. Lines of communication. This will help you with your chain of command, your flow of communication. And then we talk about patterns of nursing care. And this is a interactive flashcard. And so you've got total patient care here. Can you guys all see my screen?
Yes.
Yes.
Okay. So you've got your total patient care here. Now, if you want to know what that is, you just click on the show, and this is the definition of total patient care. Next one would be your partnership model, and this is what partnership model would look like. And then also we've given you some references, so maybe go find those references and utilize those references within your paper. Don't reinvent the wheel. We give you a lot of resources here, so you can look through and go to the library and find these and say, you know what, I'm going to use that for my paper. I think it's great. It's already cited for you appropriately. It's already referenced for you in APA format. So go ahead and utilize those. Next would be primary care. And here's the definition for primary care. Then you've got functional. Here's the definition for functional. Then you've got modular care. Then you've got case by case. Okay, more of a case management type care delivery. Okay. And then you've got team. So if you click on the interactive, this is where you can find a lot of your nursing patterns of nursing care delivery. Does that help answer your question?
Yes.
Okay. And so I'm hoping that you utilize this for your discussion questions as well, because you guys have already started this week. And so everything that you talk about in discussion, go ahead and use for your paper.
Sure.
So let's go back to modules. And we'll go back to our paper. And we were down at the rubric. Next, your last part would be your summary. And so this is where you're going to summarize your findings, and also make sure the biggest thing with this is make sure you talk about whether the organization is empowering to nurses. Students tend to forget this last part, and we'll take points off for that. So make sure you summarize your findings and then also end with whether this organization is empowering to nurses or not. And don't just put yes or no, but just put why. You're summarizing it, and then you can bring it all together with either it's empowering or it isn't. And there's some organizational structures that are not empowering to nurses. And that's okay. If that's what you're studying, that's what you're studying, and that's what you're writing about. Okay. So the length of the paper should be 3 to 5 pages in length. Now, this does not include your title or your reference page. So the beefy part of your paper needs to be at least 3 pages long. Okay. And then a minimum of 2 scholarly resources. Okay. And then, of course, we look at APA formatting and then the 80-20 rule. So any questions with this assignment?
I have a question. This is Jane.
Hi, Jane.
In our paper, do we need 2 insight quotations as well, or just the references?
Well, whenever you write an APA appropriate paper, you have to cite those references. So, you've found 2 scholarly resources, you've read them, you've taken information from those resources to write your paper. You have to cite where you got that information from. You're paraphrasing. And so
Okay.
you read an article from, pardon?
So just like I'm just confused. Sorry. Just like the discussions, right?
Yeah, those in-text citations. And so you've got your 2 scholarly references at the bottom of your paper, or 2 or 3. And then what we're going to look for is an in-text citation for each of those references within your paper.
Okay, thank you.
Awesome. Thank you for that question. So this is the main one that's coming up this week that I wanted to spend a little bit of time on. I do have some examples that I can send out. If you would like an example, please email Dr. Jabber and myself, and we will send you an example of one that was done well. And with Turnitin, we'll know if you're, utilizing other students' work, which most of you guys, you guys don't do that. But just know that you guys can reach out to us and we'll send you an example, and then you can kind of get an idea of what it should look like, and then just kind of put it all together. So regarding APA, do you guys download the APA template and utilize that?
Yes.
Awesome. And for those of you who may not know what I'm talking about, if you go to your modules, we provide you with a tremendous amount of resources, so I'm hoping that you use those. So here's your APA template. And here's how-to videos. There's a condensed one, and then there's a lengthy one. But here is your template. So what I tell students to do is go ahead and download this template and just change all this verbiage to whatever you're doing. Does that make sense? So you've got your running head that you can click on and change that. That way the margins are done, the page numbers are done. It's all done. So don't reinvent the wheel. It's all here for you. And so these are the level 1 headings we're talking about. And so like the introduction would be the first part. And then whatever's next on the grading rubric would be your next heading, and so forth. The in-text citations are correct in APA formatting. So you can just go through here and just get rid of what's written here and type in your own. Does that make sense?
Yes.
Okay.
Yes.
And then the references are all APA formatted as well. So just make sure that your references, your authors, your date, your title, make sure that everything is appropriate. But the other thing that you can utilize would be, and I keep going back and forth here, but I want to go to this week's lecture, because let's say you read the lecture and you're like, well, I really like that reference. I want to use that in my paper. So let's go to the bottom under references. So let's say you want, well, and this week we have a lot of books, but let's say you found this Spence Lanshinger article that you want to use. It's already done for you in APA formatting. So all you're going to do is you're going to copy and paste, right?
Yes.
Yeah,
Yes.
I would hope so. It's already there for you. Don't make things harder on yourself. And I would say as you go through, all the references, all the citations, they're in APA formatting. So go ahead and use them to your benefit. That's why we give you a lot of different resources. Okay.
So this is Catalina.
Hi.
Hi. For the sample paper, so should I email Dr.
Whoever your instructor is. Yep.
Okay.
Yep. And then we'll get you that paper, and then you can go ahead and look at that and specifically look at how they've done their references, how they've done their in-text citations for formatting issues, and then look at their level headings and see what they've written under each one of those areas. Because what that does is it guides the reader on what you want them to read. It's when we have to look all over the paper for something, it takes a lot of time, and then it takes points off your paper. So the more organization, the better, if that makes sense.
It does. Thank you.
Any questions before we move on?
No.
Nope.
Any questions about discussion boards, anything like that before we move on? Or any questions you guys have since I have you're in attendance? Emmanuel on the phone, any questions from you? Are you doing okay? Okay. Anybody else have any other questions before we move on?
Thank you.
Okay. So then, as we move on through the modules tab, you'll see where we get into each week. And so this is where you can find your discussion questions, your reading, your lecture. Now, the next one would be week 4. We have an assignment. This is where we want you to explore a national healthcare quality initiative. Now, this is also going to be your week 4 discussion board again. So don't reinvent the wheel. Everything that you talk about in discussion board, bring forward to help you write your paper. Okay. And so this is where you're going to reach out and you're going to look for a national healthcare quality initiative. Okay. And then here's your instructions again. The biggest part of this paper is your number 5. This encompasses 80 points. This is your plan, do, study, act cycle. And I know that this is kind of, you guys probably haven't even looked into this lecture. So I don't want you to get overwhelmed by this. Just know that if you have questions, make sure you reach out. Make sure you utilize your discussion questions to help you look for a national healthcare quality initiative. Here is your instructions. Here's your grading rubric again. Make sure that you set your paper up just like you're going to do for this first one that you're doing. Okay. Now let's say, well, what do you mean by national healthcare quality initiatives? Well, let's look at your discussion questions for week 4. Now this is just what my screen looks like. So if we go down to week 4, I don't know if it's 1 or 2. Nope, that would not be it. So here would be your quality initiatives through the Centers for Medicare and Medicaid Services. And so you can click on this web link within your discussion, and it takes you to this page here. And then if you want to go towards the bottom, scroll all the way down to Quality Initiatives, Patient Assessment Instruments. These are all quality initiatives that you can research and that you can write on. Okay. So when you're thinking about this for your paper and also your discussion, maybe start looking at this before week 4 so you can start researching and bring this forward. And so let's say you want to do the Nursing Home Quality Initiative. You're going to click on that, and this is going to give you a bunch of information and also some related links that you can use to help you. Okay. So this is where you're going to find those quality initiatives, is within Module 4, Discussion 2. Okay. And then you find that initiative, and then you go to your grading rubric and you make sure that you've captured all of the essential elements. Now, let's say that your specific place of work right now is doing an initiative, or they just finished an initiative. You can utilize that. It doesn't have to be specifically what is found on this web link. So if your place of work is doing one currently, go ahead and utilize that one. Just make sure that you have enough information to answer all of the requirements for your paper. Okay. So I don't know if you guys have looked forward enough to even think about a question for this, but is there any questions you may have? Here again, feel free to reach out for an example, and definitely will give you an example. Let me see if I can pull one up here. This would be an initiative paper here. Let me see. I don't know why. There we go. Can you guys all see that?
Yes.
Bigger. Whoa, that's like really big. Sorry.
That's like perfect.
Okay. And so this would be an initiative right here. And let's see what they're doing. They're talking about the IOM. They're talking about the Agency for Healthcare Research and Quality. So they're starting to talk about that initiative. So here's their mission and goals. And those are usually found on the websites. So that's, public knowledge there. And then they're going to talk about the population of focus. Now here is the Plan, Do, Study, Act cycle, which is worth 80 points. And you see how they've got their level 1 heading. Then they've got their level 2 heading, which is flush left over here. So here's the plan. Here's the do. Here's the study. Here's the act. And then here's your summary. Okay, and then I've taken the references off this paper here. Okay. So there's that one, I think. Do I have another one? Module 4. Yep. This one here. Oops. This one here talks about they are doing their initiative on Centers for Medicare and Medicaid Services. They just did the whole thing. They've talked about the AHRQ as well. Here's your population of focus. Here's your Plan, Do, Study, Act. You see how that's organized there? And then there's summary, and then here's their references here. So we will send you an example. Just make sure you email us and ask us for one, and then that way you can start looking forward into that. Okay.
Are you okay?
Next one. So module 5 is right here, and then number 6, we've got lecture discussions, your end of course survey. You guys all know that if you do not complete your end of course survey, you cannot get into week 8. Sometimes students will say my week 8 is not opening up, and that's just because you've not completed the survey. So they put it in between week 6 and 7, but just know you have to have it completed by the end of week 7. Okay. And once the link becomes active, we'll send that out. The link is not active right now. Then week 7, you've got a PowerPoint. So what is expected of me on the PowerPoint? Well, I'm going to click here, and I'm going to go through, and here's all your instructions. So you've got introduction, background, research, methods, results, conclusion. Make sure that you capture all the elements of the PowerPoint. Now, we say 5 to 7 slides, does not include your title or reference slide. And so if you think about each area, so you're going to have your title slide, which is number 1. Then you're going to have your introduction slide, which is number 2. Your background slide, which is number 3. And then you just go on through here, and by the time you're done, you're going to have probably 8 or 9 slides, so you'll be just fine on the length. The other thing that we expect is that you will use at least 2 current scholarly resources, and then also you will have to do speaker notes. So read down here on creating a PowerPoint presentation with speaker notes. Just think about if you were going to present this to your class or your work, you don't put copious amounts of words on a PowerPoint slide because your audience can read the slide. Those speaker notes are for you to define what you're talking about on the slides. And for Dr. Jabber and myself, this is where we'll see your critical thinking. This is where a lot of students will add their in-text citations. Okay, you still have to have citations. So anything that's on your reference slide has to be cited within your PowerPoint as well. Here's the grading rubric.
Yeah.
I'm sorry?
It should be scholarly. So don't just, yeah. And the date, it should be recent, not more than 5 years. Francis. And also, please don't wait to the last minute to submit the assignment, because sometimes the internet is not working or your computer is not working. So don't wait to the last minute to submit the assignment.
Right. And the other thing I would say is if you don't have access to PowerPoint, if you don't have access to a Word document and you're going to use like Pages or what is that other one? Presenter. What we ask you to do is to go to your Pages tab. And then this is where you get free access to Office 365. And so you click on how to access Office 365, and there is a PowerPoint that shows you how to access that. So there really is no reason that you should not have Word or PowerPoint, because they need to go through Turnitin. Otherwise, we cannot effectively, grade your product. Does that make sense?
Yes.
Okay. I mean, I can honestly say last semester I had some dot pages, which we cannot open those. And so that would delay the grade. That would delay the student being successful. So if you don't have Office, feel free to download it. It's given to you through EagleGate. So make sure that you utilize that. So let's just pull up an example that I have here. Now this was on Obstetric Hemorrhage Quality Improvement Initiative, and this was specifically from a student that worked in this area through the California Maternal Quality Care Collaborative. And so if we look at this, let me show you the speaker notes down here. Can you guys all see the speaker notes?
Yes.
Can't read. I can see them, but we can't read them.
Okay, does that help you?
Well, I can, not the speaker notes. It didn't make them bigger.
Oh.
We can read it.
Let me see what I can do here. I'm trying to move this up so I can, let me look at this one here. Why can't, oh, there we go. So here's your speaker notes underneath your slide here. I don't know if that helped you any. Maybe not. But the speaker notes are under each of your slides, and this is where you really get into the beefy part of what's on the slide. And so don't forget to put speaker notes, okay? Oh my goodness sake, there we go. So here's her research and evidence slide. Then they've got the methods. The one thing that we ask of you to do is a SWOT analysis. which talks about strengths, weaknesses, opportunities, and threats. Some students forget this slide, and that's at least 20, 25 points. So, okay. And then you've got your main results of your study. Then you've got the results. Then you've got your conclusion. And then you've got your references. Okay. So if you would like an example of Module 7 example, make sure that you email Dr. Jabber and myself and we can get you those. Okay. So you've got 3 main assignments in this course, which I think, we try to help you by initiating it first within the discussion board, so you can get all that information fresh in order to write your paper. So I emphasize it that whatever you're doing in discussion board, please bring it forward to help you with your paper. Don't do research on something else and then do research on something else to write your paper on, because that's extra stuff for you guys, and you guys are all so busy anyway. So I hope that makes sense when I talk about that. Everybody know how to access the library?
Yes.
So you can go to the LIRN right down there on the left-hand side, and it brings you into your library, and then usually I click into health and medical. Now I use ProQuest a lot because ProQuest allows me it cites my references for me. So give me an item to research. Nothing broad like nursing or diabetes or anything like that. Let's curtail it down to something. Somebody give me something to look up. It's tough, isn't it?
Elderly population in Utah. I don't know.
Sure. We'll try it. We'll see what comes up there. We've got 20,000 hits, which is awesome. So now you're like, well, do you guys know how to apply your filters?
Yes.
This is so fun to be able to do this. And so you click on your full text and give it a second to refresh. And then you click on peer reviewed, give it a second to refresh. And then scholarly journal. So now we're down to 5,000, which is awesome. The other thing we're going to do is look at your dates, because we want to be within that 5-year time frame. So then you come over here to the left and you move that little gray thing. And sometimes I have to do it twice. So now I'm 2000 to 2019. Well, I know 2000's too far out. So let's go to 2015. So now we're down to 1,447 results. And so now you can look through. Whenever you see this icon of the graduation cap, you know that your resource is scholarly. Okay. So then you can look through here and just start looking and, okay. And we might have to, you might have to put a little more detail in there so you're not looking through 1,000 of them, but that just gives you an idea of what those filters will do for the library. Okay, now let's say I'm going to look at this one, and it shows it up here, and I want to use it. So I'm going to click over here underneath this big download PDF sign. It says Cite. I click on that, and I want to make sure that I'm using the 6th edition, and the citation's done for me. So then I just copy and paste.
Right.
Yes, it's so nice. Okay. Anything we can do to help alleviate our anxiety, we need to do it in nursing school. Okay. All right. So any other questions that you guys have that Dr. Jabber or myself can hit on?
No.
Okay.
No, I think you covered it all.
Okay. Any questions about feedback within discussion boards? Specifically my students. Everything going okay?
Yeah, we're all good.
Okay. What about you, Dr. Jabber? Any of your students have questions?
Anyone
No,
have questions?
thank you.
I have some notes regarding the discussion.
Great.
Please look at the rubrics because sometimes you will lose points for something like initiating the initial post on like Thursday or Friday. You will get 0. So it's very easy. Just go ahead and do it at the beginning of the week. And websites, just use the website that we provide for you. We some websites like this week, we provide you with a website to just click on it and go ahead and look for all the information. You did not do that. You just go ahead and look for any other website that is not scholarly, that is like, I hate to do that. I hate to deduct some grades from you for something you can just like do it. Just go ahead and do like click on the website that it is on the discussion board. So everything is there for you. All the resources, everything is there for you. Why to lose points? And at the end of the semester, you will see you need just 1 point or 2 points to pass, or just to be from B to A. So this is, I don't know.
Right, and utilize those resources within the lecture as well. That's why we put them there. So go ahead and utilize them. So with what Dr. Jabber was talking about, we do have an approved list of scholarly resources. And so if you want to click on your Pages tab, it'll bring you to this page. And then if you go down to library resources, this is the approved list of scholarly resources. Okay. Do not use these websites. So blogs, a lot of web pages that end in .com are not scholarly. Okay. And so if you've gotten points taken off this last week, really look at your resource and utilize these resources. Utilize your LIRN. Not everything in the library is scholarly. You need to look for that little graduation cap icon so you know that it's scholarly, and also apply that scholarly resource filter so you know it's scholarly. Okay.
Okay.
And then your APA writing help, you can also go there and it gives you help with APA. The other thing you can do is just reach out to us. We're here for you. You know, like Dr. Jabber said, we hate to get to the end of the semester and you have 1 point away from passing. That 1 point takes a lot of little points to add up to that one big point. And so it's not just giving you 1 extra point on an assignment, because they're all weighted differently, 20%, 15%, things like that. So, read our feedback that we provide to you within the discussion boards and within your assignments to perfect it for next week. So then by the end of the course, you're successful and you definitely are ready to move forward into you guys are almost done, So this will be the recording link. Once we're done, I'll upload it, and then Dr. Jabber and I will send you the link within your announcements. Now, do you guys always go into your announcements and look and see what's going on?
Yes.
And you guys
No.
should have, make sure you go into your announcements or set your notifications so then when Dr. Jabber and myself, these are important important things that go on in your announcements. And so anything that's going on, we'll send you an announcement. We don't necessarily email you because it's found within your Canvas page. And so that's where you could find this link of the recording once we're done here, is we will put in an announcement, but you should look at your announcements and your emails daily. because that's how we get to see you. That's how we get to visit with you, because we're not face to face on campus where we can just grab you in the hallway and say, hey, I want to talk to you about something. Okay. So make sure that you look at your announcements, make sure you look at your emails. Feel free to, and Dr. Jabber and I will do the same. We'll look at our emails constantly. We've got text messages. Feel free. Don't ever think that a question is not worthy of asking. Don't ever sit there and fret about something. Dr. Jabber and I, we work, we do work late into the evening, but we are here for your guys' success. And so we want you to utilize us for that. Okay. And please, for those, maybe your friends or your colleagues that weren't able to attend today, please let them know as well that we are very approachable, that we are here for your guys' success, and there's nothing we cannot get through except procrastination. Procrastination is terrible. Okay.
Yeah.
Anything else, Dr. Jabber?
Good luck. Good luck for you. We are here for you.
Okay.
So don't hesitate to contact us anytime. We are here to help you.
Okay.
Thank you.
You're welcome. And so I'll stop the recording, and then probably within the next 24 hours, you'll see the recording link, and you'll have access for the next however long you want it. So if you need to come back and revisit, as we get closer to assignment 4 and assignment 7, feel free to, review the video again. And please tell your colleagues to watch it and to reach out to us. We're here for your success. Okay. I appreciate all in attendance. This has been absolutely great attendance for what we usually get. So we appreciate this.
Thank you.
Okay.
Thank you.
Thank you all. Thank you so much.
Thank you.